Hello friends, welcome to Gyan's Academy. In today's video, we will be learning about gout. Don't miss this video. Watch till the end to get downloadable notes on gout and practice NCLEX style questions on gout. Gout is an inflammatory disease that occurs when urate crystals accumulate in the joints, leading to pain and damage. The primary cause of gout is hyperuricemia, an excess of uric acid, urate, in the blood. Uric acid is a natural waste product produced during the breakdown of purines, which are building blocks of DNA and RNA. After it's produced, uric acid circulates in the bloodstream and is filtered out by the kidneys to be excreted in urine. Causes of gout includes overproduction of purines. This can happen due to factors like increasing age, male sex, obesity, alcohol consumption. Overproduction of purines can also occur with increased consumption of purine-rich foods such as shellfish, alcohol, anchovies, and red meat, as well as high-fructose corn syrup-containing beverages such as sodas. Hyperuricemia can also result when cells die at a faster than normal rate, resulting in increased breakdown of purines into uric acid. Hyperuricemia can also result when cells die, for instance as a result of chemotherapy, radiation treatment, as well as recent trauma or surgery. In addition, some individuals have a genetic predisposition to developing hyperuricemia, so an important risk factor is family history. Finally, hyperuricemia can also occur when there is reduced excretion of uric acid by the kidney, which can result from dehydration, diabetes, chronic kidney disease, and medications like thiazide diuretics or aspirin. Now, gout typically presents with acute attacks, in which a joint becomes red, warm, tender and swollen within hours. Gout can affect many joints, such as those in the ankles, knees, wrists, and elbows. But most often, it affects the first metatarsal joint of the foot, or the base of the big toe, and this is called podagra. Classically, podagra is a hallmark of gout, where clients experience excruciating pain in the big toe, often waking up in the middle of the night feeling like the toe is on fire. Even the weight of a blanket can be painful. The pain is most severe in the hours immediately following the gout attack, and then generally lessens over time, but the discomfort and swelling can last for a few days with treatment or weeks without treatment. Over time, repeated gout attacks can result in chronic gout, which is a type of arthritis with permanent joint destruction and deformity. Chronic gout can eventually result in the formation of permanent deposits of urate crystals, known as tophi, along the bones just beneath the skin. Individuals with chronic gout are also at an increased risk of developing kidney stones made of uric acid, as well as urate nephropathy, a condition in which urate crystals deposit in the kidney tubules. Gout is typically diagnosed based on the patient's history and physical examination. Laboratory tests may show hyperuricemia or elevated blood urate levels, along with increased C-reactive protein or CRP, and erythrocyte sedimentation rate or ESR, which are indicators of ongoing inflammation. The diagnosis can be confirmed through joint aspiration to detect the presence of urate crystals in the synovial fluid. And in case of chronic gout, imaging techniques like X-rays may detect tophi. Treatment of a gout attack is focused on decreasing the pain and swelling with NSAIDs like ibuprofen or naproxen sodium. Occasionally, corticosteroids like prednisone and anti-gout agents like colchicine can be used as an alternative to NSAIDs. Occasionally, corticosteroids like prednisone and anti-gout agents like colchicine can be used as an alternative to NSAIDs. After managing the acute attack, clients may also take medications that help decrease uric acid levels, such as xanthine oxidase inhibitors like allopurinol, as well as uricosuric medications like probenecid that increase excretion of uric acid by the kidneys. Finally, it's important to address the underlying risk factors. This may include modifying the diet and reducing or eliminating soda, alcohol, red meat, and seafood, as well as staying hydrated, and managing underlying disorders such as diabetes or chronic kidney disease, and avoiding certain medications like thiazide diuretics. Finally, to summarize gout and the important key points to remember for your NCLEX preparation, the following should be considered. Gout is caused by the accumulation of uric acid crystals in the joints, leading to inflammation. It is most commonly triggered by factors such as high purine intake such as red meat, alcohol, dehydration, obesity, or certain medications like diuretics. Signs and symptoms include sudden, intense pain in the affected joint, often the big toe, redness, swelling, and warmth at the joint. Possible fever during acute flare-ups. Diagnosis is done on based off joint aspiration to examine synovial fluid for urate crystals. Blood tests to check uric acid levels. X-rays in chronic gout to detect tophi. Acute attack is managed by NSAIDs colchicine or corticosteroids to reduce inflammation and pain during flare-ups, and provide rest to affected joint to prevent further irritation. Chronic attack is managed by giving medications to lower uric acid levels, such as allopurinol or febuxostat. Teach the patient for lifestyle changes, which includes maintaining a healthy weight, limiting alcohol intake, and avoiding foods high in purines. Nursing interventions includes: first, pain management. Second, patient education. Third, hydration. Lastly, monitor for side effects of medications. As a nurse, it is important to monitor for complications such as chronic gout can result in joint damage and deformation of tophi. High uric acid levels may lead to the development of renal stones. Nurses should assess for signs of kidney dysfunction in patients with gout. Today we learned about gout. For more topics like this, please like, share, and subscribe to our channel. Stay tuned for our next video. Thank you for watching.